Hello everybody, my name is Brandon Winchester and I'm the co-founder of blockjocks.com and also the Regional Anesthesia Fellowship Director here at the Andrews Institute. We're going to be doing a video series starting today that I'm going to introduce with this little introductory video. And essentially what we're going to be doing is scanning from head to toe. We're going to show you our basic scanning technique for each of the major ultrasound guided nerve blocks that we do, starting from the head at the blocks above the clavicle, ending all the way, not quite to the toe, but ending down near the toe at the popliteal sciatic nerve block. We're going to focus on the same outline for each of these demonstration videos. We'll start by introducing the specific block that we'll be talking about. We'll go over some of the clinical indications, when we choose to use this block, when we choose to avoid this block. We'll talk about the transducer that we use for each block, which is always a short segment because effectively we're using the wide linear high frequency transducer for just about every nerve block that we do on blockjocks.com and in clinical practice at the Andrews Institute. We'll talk about the basic starting settings for your ultrasound machine. We, like I said, always use a high frequency linear transducer, and in terms of the depth settings and the gain settings, we'll tell you about where to get started for each of those and then when to adjust accordingly. We'll tell you about the probe placement in terms of the overall anatomy on the exterior, surface anatomy using bony and muscular landmarks of the upper and lower extremity. And then we'll start talking about some of the anatomic landmarks that you'll need to point out, not just the nerve targets, but the surrounding tissues, the muscles, the planes, the vessels, of course, to avoid, pleura, things like that, lung tissue, etc. Things not only you want to know, to identify, to target, but also equally importantly, the things that you need to identify to avoid during any ultrasound-guided nerve block placement. And then finally, we'll talk about the actual block technique itself, both for single injection and continuous catheter placement. We'll talk about where exactly our puncture site is. It's an important thing to pay attention to because our puncture sites tend to, on a case-by-case basis, a block-by-block basis, tend to be a little different than the puncture site images and videos that you're used to seeing on other websites and other tutorials online and otherwise. So we'll talk about where to puncture with the needle, the general trajectory of your needle, which is very depth dependent. Depending on how deep the target is, that really depends on how steep your angle of insertion of your needle is. We'll talk about the general target for each individual nerve block, for example, the corner pocket for a supraclavicular block or the 5th and 6th roots for the interscalene nerve block. We'll talk about where the initial target is, but also where some of the needle redirection targets are. In any nerve block that we do with ultrasound, our typical goal is to have a donut sign, a donut of local anesthesia encircling the nerve. So we'll tell you not only where to start, but where to redirect your needle and where to additionally add local anesthesia injection points to further enhance the ability to provide a donut of local anesthesia around the nerves. We'll talk about the concept of hydrodissection, the way in which local anesthesia is injected as the needle is being advanced. We utilize that quite a bit in our practice, as you've probably seen on the procedure videos on blockjocks.com. So we'll talk about that with each of the specific videos that we make. And then finally, at the completion of the discussion of the nerve block itself, we'll talk about the optimal placement for the catheter as well. Now with our specific techniques, we typically don't differ very much in our single injection techniques and our continuous catheter techniques. And effectively, the catheter technique involves completing the single injection nerve block similarly to how we would have done it anyway if we were just doing a single injection nerve block, followed by the simple threading of the continuous catheter. The primary difference is not so much the technique that's initially used for the primary block, it's the fact that it's a larger gauge needle, different equipment than a single injection nerve block would be. So we'll talk about the variations in the technique once it comes time to thread the catheter and where we consider the optimal or some of the optimal locations are for the final resting place of that continuous catheter when it's being placed. And then when all is said and done, whenever you place a continuous catheter, you need to connect that continuous catheter to a disposable or a non-disposable nerve block pump, and we'll tell you approximately where we usually start our continuous pumps at for each specific block. For example, some of our blocks start at a lower rate, some of our blocks start at a higher rate, depending on which specific block we're doing, and we'll go over some of the details of that. So hope this will be interesting and helpful for you. We'll go ahead and get started.